Welcome back to my channel. I am Cece Andres. If this is your first time stopping by, thank you so very much. Consider hitting that subscribe button and go ahead and watch a few other videos while you're over here. If you are a returning subscriber, you guys already know I truly appreciate you. So today we are going to talk about the second part to my breast reduction, and that is coverage and any concerns that I had. So I wanted to discuss these things because the big question is, how do you get it paid for? Is it covered through your insurance? Do you have to pay for it out of pocket? And then what are some of your major concerns for this exact procedure? First things first, I got mine covered through my insurance. And if you pay for insurance, if you have state insurance, whatever the case may be, if you have any type of insurance, try your insurance. I mean, why wouldn't you? Why wouldn't you want to try the insurance first? Come on now, people. So try your insurance, because if you don't have to pay for this big procedure out of pocket, then why spend the extra money? A breast reduction can range anywhere from $7,000 to $15,000, just depending on what's all included in a procedure, what all they have to do, how much breast is actually being removed. So some ways or other ways that you can pay for it is through your credit card. There's a lot of people that I hear in multiple states say it's a thing called care credit that people get, and you can pay for different type of surgeries. If I'm not misunderstanding with that, you can pay for it cash. You know, however the money spends is how you can pay for it. We know the money spends, so whatever spends, that's how you can get it paid for. Now, specifically with insurance, it does depend on your carrier whether or not they are going to cover it for you, and if they are there any requirements for them to do so? In my previous video, when I told you guys that I went about 6-7 years ago and had a consultation, I had a different insurance at that time, and those requirements may have been different for that particular company versus the company that I am with now. Because I did not look into it further after that consultation, I can't tell you what those requirements would have been. Now with my current insurer, they required that I have a reference from my primary care, which I did not know that. I just generally speak to my primary care, my PCP provider, about everything. I start there first whenever I have any major concerns or questions. And good thing that I did, because that is actually where you want to start. You have to start there. So I started with getting a referral from her, or a reference from her, to a plastic surgeon. And then I had my consultation. So I had my consultation with the plastic surgeon, and then after that I had to go see a neurologist. I talked about how I had to do another step before I was able to get approved or not. So some insurances require that you do 4 to 6 weeks of physical therapy combined with seeing a neurologist, combined with medication, or they may have one of the things or all of the things. So it really just depends, because remember, they don't want to actually have to cover it if they don't have to. They don't want to have to pay for this procedure if there are other ways for you to have pain relief. So with mine, I had to see a neurologist. That was the appointment that was originally scheduled for the beginning of January. Due to the pandemic, all of the doctors are kind of backed up. Appointments are further out. So that appointment was actually scheduled for January. But when I called, I asked the lady, the receptionist, if there by chance was any cancellations, could she put me down? And she said she would absolutely. Thank God that I asked her that, because I never asked to be put on a wait list. I never asked to, I just don't. And this particular time I was like, okay, well, you know, if you could just put me on there. I really didn't think that anything was gonna happen. I didn't think she was gonna call me. I'm like, people are definitely keeping their appointments because they are so far in between, you know, for you to be able to get one. So she ended up calling me in November and told me that the appointment for someone had canceled for the appointment for the next day. When I went to that appointment, the neurologist had did a few different exams. She touched certain places on my back and arms to see if there was any pain. She had me do certain stance, certain walks, certain movements and techniques to see if there was any pain or numbness radiating from anywhere. And after we went through the full exam, she then told me, like, I agree and I approve that you do need this breast reduction. Whew, y'all, I was so happy that she said that, because I did not know what she was going to say. I did not know if she was going to approve, if she was going to say you may just need to do physical therapy. I did not know. And considering that I did this a while back or a couple years ago and I didn't go through with it, and I'm like, okay, now I'm actually giving it a try, the worst thing would have been for them to say no, you know, she didn't approve, or I would have had to do other measures, because I really was not trying to have to do that. Anybody that has ever had physical therapy, first of all, y'all know that that is not for any games. Like, physical therapy is not for the weak, honey. Like, it's just not. It's not. We're just gonna put it there. It is absolutely not. But I didn't have to do that. So she told me right then at that appointment that she will go ahead and send over the information to my plastic surgeon, letting them know. However, when I left my consultation and my plastic surgeon gave me the reference to go, or the referral to go over to neurosurgery, he told me, when you leave the office, if the doctor says at that point that they approve or they think it is a good idea, anything in that way, shape, or form, call us immediately. We can wait for the paperwork to come to push everything through, but we can at least get you on a schedule. And that's exactly what I did. So I called them, I let them know. At that point, the paperwork was pushed over to my insurance, and usually you have to wait about 30 days. Mine was a few days shy of 30 days. When doing my research, I seen that some people said that they got theirs within 2 weeks or the next week. I was not that lucky. But I am glad that it was within that 30-day time frame, and I'm glad that there was not any pushback. I received a letter in the mail stating that I was approved. I'm a few days shy of the 30-day waiting period. I immediately called my plastic surgeon to let them know, because the nurse did tell me that sometimes they may receive the information that I was approved before I do, or it will be vice versa. So we needed to be able to communicate with each other so one or the other would know what was going on, just in case the other party hadn't received the information. So I immediately reached out to my doctor's office. I let them know, hey, I received my paper. They said that they were going to approve it. Now, my specific insurance approved 80% of the coverage. I was responsible for 20% of it out of pocket. I cannot complain about that. I know that there are some insurances that does cover 100% of it. We would have taken 100%, of course, but you know, we ain't gonna fight it. We ain't gonna fight it. 80% is what it is, okay? So they cover 80% of it, and then I am responsible for 20% of it out of pocket. And yeah, so they instantly put me on a schedule for a pre-op appointment, and I had that pre-op appointment January the 19th. At that appointment, we went over just a few things, make sure all my blood work and everything was accurate. The doctor did explain again the specific procedure that he was doing for me, and discussed recovery, also asked if I had any questions or concerns, and then he booked my first post-op appointment at that pre-op appointment. So my very first post-op appointment is already booked, and he booked that one at that specific appointment, so I can already be in. They usually want you to have that within the first week of your actual surgery. So now I am all set to go, guys. I am getting a little bit more nervous as the time comes, because I have been under twice. In 2013, I went through an episode where I literally thought that I was dying. I was in so much pain. I could not breathe. I felt like I had to use the bathroom, but I couldn't go to the bathroom. I was breaking out into sweats, and I went to emergency and realized that, or was informed that I had gallstones and I needed to be rushed into surgery. I never had a gallstone attack prior, never had any issues that indicated that there was any stomach issues or anything going on. The first attack took me out of here. That particular procedure, I was nervous. I had never been under, and I don't know if y'all seen that movie Awake. I don't know if anybody's seen that movie Awake, when that boy went under, but he was paralyzed, of course, from the anesthetics, but he did not go under mentally, and he was feeling everything. I'm like, Lord, I'm gonna be the one patient that when they try to put under, it ain't gonna work, Lord. I'm like, Lord Jesus, please don't let me be awake and these people think because I can't move or I ain't saying nothing that I'm sleeping, I'm out of it. I do not want to be that patient. That was my biggest fear. It wasn't the fear of not waking up. I mean, if I went to sleep and I didn't wake up, would I have known the difference? Not to say that I have wanted anything to happen, but my concern was if the medication did not work properly and I felt the pain, what was going to happen? By the grace of God, I didn't feel anything. I went into that surgery. The lady said, I'm going to give you some oxygen for you to be able to breathe. And I'm like, okay. Took a deep breath. I don't know what happened after that. So I went under for the second time in October or September of 2021, and that's when I had to have it on my elbow and my wrist for my carpal tunnel release. I'm supposed to have that same exact surgery on my left arm, but they of course do not do them both at the same time because you won't be mobile with that arm for a good while, and then it takes months for it to get better. I'm talking months for it to get better. So I've been under twice now. This specific procedure, even with me already going under twice, first off, I am not the type of person that wants to get surgery just to have surgery. I'm not mad if you do. It's not a problem. Me specifically, because of that specific fear that I had, I prefer not to do it. So my concern now is, as the days are getting closer and closer, this video is less than 2 weeks away from the procedure. So for the last couple of days, I've just been having so much go through my mind about the surgery, and not negative. It's just like I can't get it off of my mind. I cannot stop thinking about the actual surgery. I'm like, I cannot stop thinking about it. And with it being the chest, and then with it also being your breast, like I said, I don't have a problem with the way that my breasts look. I'm confident in my breasts. Will I be glad that they are going to be smaller, that I will be able to have the opportunities that I have not had, that I will have the relief of pain? Absolutely. But you know, I don't know if it's just the chest with them being chest. I'm like, now don't go too far down now. Don't go too far down. Go where you're supposed to go, and only where you're supposed to go. Don't be going back. Don't be going, my heart is back there. Don't go too far. Do not go too far. So that's kind of been on my mind. But I love God, and I know he loves me, and I know if I'm gonna get up out of here, this ain't gonna be how he got it planned. But moving on to my concerns outside of that. If I had any concerns with the actual procedure or recovery itself, my concern was nipple placement. I ain't never been cross-eyed. When I get off this table, I don't want to be cross-eyed. Okay? I ain't never been, and I don't want to be. That is not what I want to do. So please make sure that my placement is a-okay. I did discuss that with my doctor. He is not going to have to detach my nipple. There are some procedures where your nipple is detached. You heard what I said. There are some procedures where your nipple is detached. And in those cases, when they reattach it, 80% 90% of the time they say that everything works perfectly. There are all those instances where the nipple dies and they have to do a skin graft and things of that nature. Mine will not be detached, so I will keep the blood flow. I will keep nipple sensitivity. For people who want to have children, if you want to breastfeed, then you'll still have the ability to breastfeed. Any other concerns? Scarring. I hear a lot of people say that they're worried about the scars. You know, if the scars is gonna be an issue. Listen, when you have been in the pain that I have been in, when you have tried the things that I have tried, when you have not only had a consultation once but twice, going back and forth with whether or not you should do this, scars is the last thing that I am worried about, okay? That is the last thing that I am worried about. I am glad that he's doing the procedure that he's doing, so I won't be having the anchor method, but I will have the one scar that goes from right up under the nipple down to the chest, and that line will fade. Sometimes it fades completely and then sometimes it's a light line. Listen, I'm okay with that. They give you things to try to help make sure that you don't keloid. Of course, African American skin is completely different. Sometimes it happens, sometimes it doesn't. I don't really have an issue with keloiding. I have had like a soft one from my arm, but it went down very significantly with the products that I had used, so I wasn't worried about that. But when people do keloid, they usually keloid in the under breast scar or on the under breast scar, not on the one from the nipple down. So I'm gonna be keeping you guys updated on that anyway, so you'll be able to know what is really going on. Other than scarring, I didn't have any issues, and like I said, specifically for me, scarring was not an issue. Some people say that it is, but for me specifically, scarring was not an issue. So I am now just excited to see how it goes, the recovery, and then my end results. My doctor did inform me that with any breast reduction, you're really not going to be able to see your full results until your 6th month. So not to buy any real bras until 6 months. You can't wear any underwires anyway up until then, but not to wear any real bras until then. So you're gonna really have to stay in like bralettes or sports bras, things like that, with no underwire that's really comfy, and you know, it's not a specific size, because the breasts will be adjusting, they will be falling into their natural spots, and everything will be kind of, you know, trying to mend back together, and you can buy your bra too soon and it might not be the right size. Some people said that, you know, the first couple weeks they felt smaller than they did when they got to their 6 months. It was not a significant difference, but it was a difference. Some people said they were more swollen, and then by their 6 months they were a lot smaller when they settled into their size. So I told my doctor that I want to be a C cup. Okay, hear me out. Hear me out. Breast has a combination of breast tissue and breast fat. Me specifically, my doctor informed me that I have more breast tissue than fat. That's why my breast is actually heavier. They look like they fit my size. They're not those really thin, long, saggy boobs. They're full, and that's because I have more breast tissue. They're more dense. I have more breast tissue. So, because of that, you know, you have to still be careful how much you take out and what you do. But I wanted to be a C cup because he explained to me that in the period a few years ago, a long few years ago, I had lost like 35 pounds in 4 or 5 months. And when I did so, my breasts did not change. People who tend to lose weight and their breasts do not change, a lot of times it's because you have more actual tissue than you actually have fat, and you won't really see a change. And if that is my actual case, if I become a C cup, and God forbid, because what I ain't trying to do is gain any more weight, but if I gained any more weight, that'll give me some leeway. And if I lose weight and they don't go down, then, you know, I'll still be okay with that C cup. I do have a trainer membership and everything ready, one way or another, for when I am done with my procedure. I am really good at working out. It's just that I have a hard time working out because of my asthma. So that was also one of my concerns. I can't really work out the way that I want to because I have asthma and I also have this pain. And having the extra weight on your chest and wheezing and things like that is like, it's crazy. I know it will not take away my asthma. I know that it will not cause everything to disappear, but if it could help significantly, then I'm okay with that. I'm okay with that. So it's not much more that I want to do. Hold on, guys. This is my husband. Hello. So that was one of my concerns, and other than that, I don't really have any other concerns. My doctor's like, I can take you down to a D. I'm like, doctor, the only thing I'm trying to see is a C. That's all I'm trying, that's all it's gonna be. That's all I'm trying to see. But I do know that he wants to make sure it looks proportionate to my body. That was one of his concerns. I'm not concerned about that because when I get up off this table, as soon as I get the clearance, honey, the lifestyle change is coming to a video near you. I am not a bad eater or anything like that, but because this is something significantly that should be able to help me reach the goals that I want to maneuver through a little bit better, I'm really, really excited about being able to get back into the gym, being able to start back working out the way that I want to, and you know, just having an overall healthier lifestyle. If you enjoyed this video, don't forget to hit the like button down below. Don't forget to leave a comment for any questions or concerns or information that you would like. I would love to get that information to you in another video. Yeah, and let me know if you've had this procedure, if you've been considering the procedure, and if there are some things that you are afraid of or concerned about. Let's go ahead and talk about it in the comment section. Until the next video, guys, I hope that everything you touch turn gold and that you get everything your heart desires, and I will talk to you guys later.
I'm a hiatus. Baby, don't check for me.